So with that, I'd like to get things started now. And our first presenter is the Assistant Commissioner from the Department of Health, Assistant Commissioner Nancy Scotto-Rosato. Assistant Commissioner, the floor is all yours, and thanks for joining us today.
Thank you, and hello, everyone. I'm delighted to join you today on behalf of Commissioner Persichilli. Please allow me to extend her thanks and mine for the invitation. Supporting and encouraging wellness in the workplace makes good business sense. Wellness is vital to preventing and managing chronic illnesses, reducing stress and anxiety, improving mental function, and increasing productivity. It also promotes healthy relationships, enhances self-awareness, encourages personal growth and development, and improves employee engagement. I will give you a few examples of wellness programs and services for New Jersey state employees and residents. As we all know too well, for the past 3 years, we have been living through a historic event, a public health crisis that has taken over 1 million lives in the United States and nearly 6.5 million lives worldwide. During the pandemic, we were suddenly forced to adapt to the new normal, including working from home, homeschooling children, lockdowns, quarantines, and the mandatory use of face masks in public. Adapting to the new normal brought changes to our personal, social, economic, and spiritual lives. The pandemic also resulted in a dramatic drop-off in preventative, mental health, and basic chronic disease screening and care. Among the most impacted by the pandemic were children. Even before lockdowns and restrictions began, there was a rising trend of mental health concerns among young people. Suddenly, families were confronted with challenges COVID brought to their children and other family members. Some families continue to experience the after effects of COVID, including physical and mental health challenges. The state of New Jersey continues to prioritize the well-being of our residents. We're especially dedicated to New Jersey's youth and supporting their mental health. We are committed to helping our children and families get the support they need through a number of programs at the state, including the Department of Health. Additionally, the Department of Human Services provides a full array of services and evidence-based practices that support employment, education, and housing. As we expect COVID-19 to stay with us for a while, employers can promote wellness and protect employees from COVID and other infections in the workplace by doing the following. They could encourage employees to get vaccinated against common infectious diseases, such as COVID, influenza, hepatitis B, and measles, and provide resources for them to do so. To ensure the surfaces and objects are regularly cleaned and sanitized, especially high-touch areas such as doorknobs, keyboards, and light switches. Encourage employees to frequently wash their hands with soap and water or use hand sanitizer, cover their mouth and nose when they cough or sneeze, and avoid touching their face. Employers can provide facial tissues and hand sanitizer dispensers. Communicate clearly and regularly with employees about workplace policies and procedures related to infectious diseases, including any changes or updates. We know that the viruses can cause lasting symptoms, and COVID is proving to be no exception. Long COVID includes a wide range of health problems that can last for weeks, months, or years. Not everyone experiences the same symptoms. However, there are some symptoms that are commonly reported, such as tiredness, difficulty breathing, thinking or concentrating, muscle and joint pain, and changes to taste and smell. There are certainly mental health impacts of long COVID as well. Time and research will tell us how long COVID will ultimately impact public health. Long COVID is real, and companies should ensure a work environment that offers a supportive culture for employees and encourages self-care and well-being. For our healthcare providers, New Jersey state employees also have access to wellness programs and services, both in person and through telemedicine. A few examples of wellness programs offered by our healthcare providers include medical therapy and behavioral telemedicine services. Online fitness and wellness programs include incentive prevention, and recovery sessions, yoga, stretch and breathing, exercise programs for back and joint health, and weight loss. Telehealth and remote patient monitoring represent the future of healthcare delivery. And while they cannot completely take the place of in-person visits, they can be used to improve access to care, reduce health disparities, and costs and other healthcare barriers. In New Jersey, another wellness program we have available for state employees is the Employee Advisory Services, or EAS. It's not different from employee assistance programs designed to help employees and their dependents with personal, family, or work-related issues that may adversely impact their work performance. Staffed with professional counselors, EAS offers confidential assessment, counseling, and referral services for employees and their dependents to improve health and productivity. EAS also assists employees and dependents by providing counseling sessions for wellness and fitness, depression, anxiety, stress management, and grief. Employees also have commonly monthly access to online resources, such as a newsletter, webinars, and other on-demand programming. Since the early days of the COVID-19 pandemic, the Department of Health employees have been joined by Willow, a 10-year-old therapy dog whose calming presence has helped staff cope with the challenging work of protecting and improving public health on behalf of New Jersey communities. Right. With CDC funding, the department is also creating 2 initiatives to integrate additional therapy dogs as part of employees' wellness programs at state and local health departments. Research has shown that therapy dogs in the workplace can lead to increased social support for employees, increased employee productivity and engagement, enhanced physical health, lower overall stress levels, and other benefits. We saw that with Willow. The first initiative under the 6-month Project Willow Animal Assisted Support Employee Wellness Program includes the implementation of certified therapy dog visits at 12 designated Department of Health sites located throughout the state. The goal of this program is to foster a positive, supportive, and comfortable work environment for employees. The second initiative under development will place these therapy dogs and handlers in 1-year increments among existing staff at the state, county, and local health departments. For New Jerseyans, the primary goal of our initiatives and programs is to help all residents live long, healthy lives and reach their highest potential. Let me highlight just a few. The Murphy administration has put in place a whole-of-government approach to improve our maternal and infant health outcomes through the First Lady's Nurture New Jersey initiative. This initiative aims to make New Jersey the safest and most equitable state in the nation to deliver and raise a baby, with a focus on Black and Hispanic moms and babies. For our Healthy Women, Healthy Families initiative and other perinatal workforce initiatives in my division, the Division of Family Health Services, we have strengthened and diversified the maternal health workforce by training and engaging community doulas, integrating community-based health workers in maternal care, and through investments in midwifery education and training. The department is also investing in food security under the Healthy Corner Store initiative, working with small mom and pop shops to help them increase access to fresh fruits and vegetables in communities, especially in communities that are considered food deserts, creating a sustainable, healthy environments. For many older adults living on a fixed income, affordability is key. Our Senior Farmers Market Nutrition Program works to improve the health and wellness of low-income seniors and promotes nutritional health by providing them with locally grown fresh fruits, vegetables, and herbs. In closing, Both New Jersey state employees and residents have access to wellness program services. Through our healthcare providers online or by phone, our state employees have access to a variety of wellness programs and services. New Jersey residents also have access to programs and services, including nutrition and fitness, tobacco and chronic disease control, and even summer wellness programs. For more information about wellness programs and services offered by the Department of Health, please visit our website at www.nj.gov/health. At the department, we look forward to continuing our partnerships, not only to help all residents live a long, healthy lives and reach their highest potential, but also to build a stronger, fairer, more resilient, and healthier New Jersey. Thank you for this opportunity to discuss the department wellness programs.
Thank you so much, Assistant Commissioner. That was extremely informative, and the resources that you have brought forward are very important for us to take advantage of. So I hope sure that everybody's going to check on the website and see the resources that are available to them. Thank you again for your time today. Thank you for all that you and the Commissioner are doing to continue to keep us healthy and safe here in the state of New Jersey. Yours is not an easy task these days, so appreciate your time today.